Hello, hello, hello. Good afternoon, everyone. I'm so excited to be here. I'm so excited that you guys are tuned in with us. We have had a great past couple of days, Monday, Tuesday, no, Tuesday and Wednesday. We've had a great couple of days dealing with the whole woman, dealing with our greatest issues. And today is the same thing. I wanted to start off with a little quote for you guys. Did you know that approximately 60% of Black women ages 20 and older have a cardiovascular disease? Approximately 60% of Black women have high blood pressure, and only 2 in 10 have their blood pressure under control. Now, for me, that was crazy, but it leads to what we're talking about today. So, hello again, I'm Brianna Matthews, and today we are talking about hypertension and heart disease, some of our biggest threats. Today, we will have with us two amazing guests to talk about this topic. We will have Victoria Brasher, a family nurse practitioner who is married with 2 children. She's been in healthcare for over 16 years with a diverse background in nursing, which includes correctional nursing, school nursing, long term care, and ICU, and she treats individuals from infancy through adulthood. We will also have with us Dakota Wyatt, a third-year medical student whose passion is healthcare and holistic wellness. She has served as the American Red Cross Community Education Instructor and Outreach Coordinator in Tuscaloosa. She has also worked with Girl Inc. and has served as Unicorn Leader for Black Women in STEM.
Hello, hello. Good afternoon, everyone.
Hi, everyone. How are you?
I am Victoria Brasher.
I'm Dakota Wyatt, and we'll get started. All right. Okay, so everyone should be able to see my screen, see the PowerPoint. And so today we're going to be talking about the whole woman. And so thank you, Brianna, for that great intro. We already introduced ourselves, so we'll keep it moving. And so this is going to be interactive. And so I want you guys to, write in the chat, unmute yourself, whatever the case may be, and answer this first question for me. What is the number one cause of death in women?
I see someone saying heart disease.
Yeah, I see one person did. So great. So we'll keep moving. And so, yes, that is the answer. Heart disease is the number one cause of death in women. Sometimes people think it may be like breast cancer or things like that. But it is important to note that heart disease is actually the number one. And so, here, this is just a little definition. And so, when we say heart disease, that's also called cardiovascular disease. And it's basically just this big term to encompass coronary artery disease, hypertension, heart attack, stroke, heart failure, and arrhythmias. And we'll talk a little bit more about that today. And so the first thing is the risk factors. And so the different things will be like smoking, diabetes, hypertension, being overweight, unhealthy diet, physical inactivity, alcohol use, and menopause. And we'll talk a little bit more about the menopause on the next slide.
And on the risk factors, a lot of people wonder why these things cause us to be a greater risk. Smoking, you're 6 times more likely to have an MI, which is a heart attack. If you have uncontrolled diabetes and hypertension, that weakens our arterial wall lining. So that is the reason for that. Being overweight, it increases the fat tissue. Therefore, that requires increased blood volume, basically causing more demand of the heart. Unhealthy diet, basically salt, having too much salty foods or saturated fats in your diet, that causes your arteries to clog. You have a lack of physical activity, meaning less than 30 minutes a day. That also will cause the risk factor of the heart disease. And the lack of estrogen when you get into menopause, it actually will cause a plaque buildup when you don't have as much estrogen in your body.
Okay. And so we'll go to the next one. All right, so this is just kind of like a little phrase that my professor uses to help us remember what estrogen does. And so, just to make things simple, estrogen, we can call that our woman hormone. And then androgen is like a number of different hormones, but we'll make it simple and say that's the male hormone. And so, basically, what happens is that when estrogen starts to decrease, what we start to have an equal risk with males. And so, before estrogen decreases, we have like a protective factor. But then when it starts to decrease, what happens is that we level out. So we're not at more risk than our male like friends, but we are at like a level risk when estrogen starts to decrease. So what can you do about it? And so here's the scripture. I think it's just really important to take action and take care of our bodies because God wants us to be able to live and be able to fulfill our purpose. And so in order to do that, we need to take good care of our body and the temple that He's giving us. And so this is just a quick scripture for that. Okay. So number one, take a front seat to your health. And so you want to ask questions at your next primary care visit. You want to make sure that you're monitoring like any new symptoms and you want to write them down. And so you have all like the puzzle pieces and you go to your doctor and the doctor is going to take all of those things, put it together and be like, okay, this is what we need to do. And so in order to do that and to better serve you, you need to write them down, take note of those things with dates and times. The biggest thing we're going to talk about today throughout this whole presentation is listen to your body. Don't ignore the signs. Your body is always talking to you. And so you want to take note of that. When your body talks, it tells you I'm tired or I'm hungry. And so you have to listen to the signs so that you can handle things if needed. All right. So the next thing you can do is get the facts. And so that's what you're doing today. And so I'm glad you guys are here. The next question will be, what are the signs of a heart attack? And
I think this question is definitely important. When I looked at that first quote that I brought up first thing this morning, one of the things was that in Black women, we actually are like the least likely to even recognize the signs of having heart attacks.
Right.
And I was just like, why is that? I don't know why it's like this stigma of like Black women being so strong that we definitely don't even recognize our bodies kind of like breaking down. So I definitely think this is a great question for us to ask while we're on here.
Yeah, that is great. I'm glad you bring that up because we're going to talk a little bit about that today.
Okay. And in general, with this, we women do still have those signs, like men. The general pain, the chest pain, the heaviness, the pressure, the tightness. So we don't negate that because we still have that as females can have those. But also with females, the fatigue and the nausea can be also a sign of having a heart attack. So.
Okay. And so just to give you kind of a definition and like a visual, and so basically what exactly is a heart attack? We've heard that word a lot, but just so you're aware of what that actually is. And so the heart has these coronary arteries, and those are the arteries that feeds the heart. And so it's feeding it with blood, it's feeding it with oxygen. And so something such as fat that you see in the picture here, if something clogs that up, and then what happens is that, the heart can be damaged because it's not getting what it needs. And so that's just kind of like your visual for today. And then, like we said, the signs. So listen to your body. Like we said, chest pain, shortness of breath, pain or discomfort, all of those are very real things. But it's really important to know as a woman, like Brianna mentioned, we can have different symptoms such as feeling nauseated, lightheaded, or unusually tired. And some people don't know that. And so, again, we go out through life and we're just kind of walking around and we're feeling this way. We're not thinking about it. Don't be afraid to ask someone. Don't be afraid to, call the doctor so you can at least talk to the nurse or anything like that so that you can be assured that nothing is going on. Okay. And so here's another one. This again is getting the facts. And so question 3 is, does anyone know the signs of a stroke? Okay. All right, we'll keep going. All right, so just to give kind of a definition before we get into the signs, all of these you're going to see are very similar in that it's all about getting blood, getting oxygen. And so here, the difference is that it's the brain, and the brain is not getting the oxygen and the blood that it needs. And so it can cause damage to the brain. And so we'll go to the signs, which are really important. And so here's a way you can remember it. B, fast. And so for B, it's going to be the balance is off. E is the eyes have trouble seeing. F, the face is uneven. And when you say uneven, it's like, is the face lower, one side lower than the other? A, the arm is weak. S, speech is strange. And then T. And T is a super important factor because with all of these, you want to make sure you're getting help quickly because there's different things and there's different ways to help depending on how long the problem has been happening. And so we'll talk a little bit more about that.
And in general, as she pointed out for us, the time frame that you will ideally want to stick in stick with is 3 hours. So that's 3 hours from you having or noticing your first symptom going to be diagnosed. So meaning you've noticed this droopiness in your face, you need to get to the ER as fast as you can, because that helps prevent more permanent damage. So that's the faster the better. That's what we're trying to get. You get there to get the help so that you won't have the permanent damage or residuals from having a possible stroke. I also want to add that the American Heart Association also said 1 in 5 women ages 55 to 75 are at risk for a stroke, but 4 in 5 are preventable. So this can be highly preventable. And that's with majority of cardiac disease, but specifically with strokes, they can be preventable.
Yes. So time. Listen to your body. All right, so the next one with Get the Facts is going to be arrhythmia. And so some of you guys might have heard of this, but we're going to just talk about it. It's a lot of different parts that play a role in this. There's a lot of different kinds of arrhythmias, but basically it's an abnormal heartbeat. And it's important because it can also lead to stroke or heart attacks. And so if you know that you have an arrhythmia of some kind, you want to make sure you're getting it monitored with the EKG, and then also with your doctor, healthcare provider. You want to make sure you're meeting with those people so that you can be aware of what's going on. And so what are the signs for those? Those are kind of different. And so heart skips a beat, fluttering in your chest, dizziness, fainting, breathlessness, or chest pain. And so these are kind of weird because it's like some of these can be like anxiety, or maybe you haven't eaten well today and so you feel kind of dizzy. So it's really important to, again, if it's a new symptom, you want to get it checked out. You want to ask questions and you want to listen to your body. You definitely want to just get it checked out. It's no harm in getting things checked out. Don't feel like you're ever saying anything that's dumb or doesn't make sense. Always ask questions. And so, again, listen to your body. And like we've been saying, listen to your body. If you don't get anything from this presentation, listen to your body. Okay. So the next thing is going to be, we just talked about, take a front seat to your health. That's one thing you can do. The second thing is going to be, get the facts. And so you guys got some facts just now. And the other thing is you want to monitor your BP. And so you want to make sure you're doing it the right way. And so a lot of things can raise your blood pressure or lower your blood pressure. And so you want to make sure you're doing it the right way. If you have hypertension, you may want to record it twice a day. If you don't, maybe you just want to keep an eye on it. But as far as how you take it, you want to make sure you're not talking, you're eating or drinking while taking the blood pressure. You want to make sure your feet's flat on the ground and your back supported, just like that young lady in that picture. And then you want to make sure that your arm is at heart level. However, you don't want it to just be like hanging in the air. You want it to be like laying flat on the table, just like the picture shows.
And making sure you're relaxed. A lot of times people either jump right out of bed or come straight home from work, want to check their blood pressure. That is not the correct time to check it. You should sit at least 5 or 10 minutes relaxing, trying to relax your body, and then take your blood pressure. Also, I would like to note proper cuff size is very important when you're doing blood pressure checks. I know a lot of people at home, they like to use the wrist blood pressure machine, which is fine, as long as you're using it correctly. So with that being said, the way that you do use the wrist blood pressure cuff, it would need to be over your radial artery, which is the artery that's, if you can see would be on your thumb side. So that would be the proper placement for that type of cuff. And still everything else applies. You still need to be limp, calm, flat bladder has been emptied, no caffeine or coffee for at least 30 minutes, or exercise prior to checking your blood pressure and things of that sort. So, but that is an important factor that people a lot of times don't realize, because you can get some inaccurate readings when the cup size is not correct.
Right. All righty. So this next one, so this is a picture of a blood pressure log. And so there's so many resources out there. And so if you go on Google and you type in American Heart Association blood pressure log, or maybe you can even type in blood pressure log, and this will come right up. And you'll see that it gives you some instructions, and then it also gives you the dates and the time as well. And so this is really nice because you can record this stuff at home. Because what happens a lot of time, we're at home and we have these things going on, like we have these maybe inaccurate readings, or maybe you have some high readings, and then you go to the doctor and it's fine. And so your doctor's only seeing you in that set period of time. And so in order to like really give your doctor the best visual of like your health, then it's nice to keep a log and bring that to the doctor. That's one of the best things to do. And I also want to take the time to just mention like really quickly blood sugar. And so if you are a diabetic, you do need to check your blood sugar multiple times a day. So I've added this little picture off to the corner just to add it right here because that's really important too. But yeah, just keep a log. This is the same thing with like new symptoms. Always keep a log so that when you go to your doctor, they can help you to the best of their ability. So the next thing that you can do is going to be diet. And so for me, when I become a provider, I would like to meet my patient where they are. So I'm not saying you eat lettuce every single day. I'm just saying that you should make better choices and make smart, small goals, and then you can add on to those goals. And so, for instance, I really like Lay's potato chips. Instead of my Lay's, I decided that I'm going to start eating like peanuts for my snack. And then I really like taco salad. And so instead of using the normal seasoning, I'll just use like the low sodium seasoning, and it tastes the same, I promise. And so, yeah, just make better choices. They have a lot of different things out there that you can try. And of course, drink water.
And it's okay to do things in moderation. That's the big ticket item because, no one, every now and then, we talk about the red meats and things of that sort. And, people love their red meats, but it's okay in moderation. Like me personally, I'm not a big pork eater, but I probably eat pork about every 5 months or so. That just if you do it in moderation. And when it relates to the sodium, we'll touch just a little bit on the nutritional labels. It is important to kind of know what's going on with that. You want the salt intake, salt follow water and tends to hold on. So that's why that volume overload causes that increased blood pressure and things like that. So that's why salt is so important when it relates to the diet and not having too much of it. So ideally you would like less than 2 grams of sodium a day to be in your healthy diet kind of stance and not to go too far over that. Herbs and seasons is a great way to eliminate sodium out the diet. You can use herbs and season it just fine, and it tastes just as well. So just making small adjustments here and there, and knowing, okay, I can't have cheese every day. I'm a big cheese head, so I'm guilty personally for that. I love cheese, but cheese is not the healthiest choice when we're talking about this. So instead of whole milk, skim milk, or 1% milk, instead of white rice, brown rice, things of that sort. So
yep. So it's just all about just changing some things up, making small choices, making small changes, and seeing that and how it affects your health. And so here's just another resource that is available. So you can go on American Heart Association and they have these recipes that you can cook at home and they're going to be healthier options. And so, like I said, there's always resources out there. I think American Heart Association is one great one. And so here's this one. So get active. And so the doctor recommends 150 minutes a week. And so how does that break down? About 30 minutes Monday through Friday and about 50 minutes maybe 3 times a week. And so again, I would want to meet my patients where they are. And so maybe, maybe you can't do it all the time, but it's nice to get a 30-minute walk in the neighborhood or park. Maybe you don't want to go outside, and that's fine. It's hot. So maybe you can do free at-home YouTube videos. There's tons of videos out there, not just 30-minute ones. There's a ton of ones that are out there for different time periods that can meet you where you are in your fitness journey. And then lastly, maybe the only time you really get out is to get groceries, and that's fine. But maybe you can make the option to just park a little further just to get your legs moving and get that blood circulating. And I say during the day for safety purposes, but these are just some options for you. There's different ways that you can get active that's available to you in the community. And so you should definitely look into it. That's another way you can help with heart disease. Okay. And so number 5, go to the doctor regularly. And so, this looks different for everybody depending on what type of, chronic medical issues you have. You may go more often or you may just go once a year. The way that I like to think about this is, as far as church. So we go to church and it's maybe not because our life is just really bad every single day. We go to church so that we can put that armor on and we can better prepare ourselves for the days to come. And so I think this is the same thing with going to the doctor regularly. You want to make sure that you are, just prepared and that you know what's going on in your body. And, that's something that everyone should be doing, no matter how old you are. I know, especially with me being like younger, people are like, oh, I'm young, I'm healthy, I feel fine. But even for young people, everyone needs to go to the doctor and get checked out. And that should be done regularly.
Yes, and I agree with that regularly. Like she said, if you're younger, might be just once a year for you. For women, you should probably be twice at least a year. The reason why I said twice a year for you, because you should have a primary care provider that does like general practice type things. That's my own personal view. And then you have your OBGYN, your specialist with that. So that's at least twice a year. And that's someone that doesn't have any health issues. And the thing is, like Dakota said, is being proactive, and that's part of your proactivity. Going to your provider, seeing where you're meeting mark, where you're not possibly meeting the mark, and what adjustments you need to make towards that. If you're obviously on blood pressure medicine, I recommend at least twice a year, just because of that. We consider that a chronic condition that should be regularly checked. Labs work should be done. So that I would say at least twice with that. Of course, if you have other things going on, as she suggested, there will be more frequent doctor visits. But going to see your doctor, there should not be any fear related to that. I know in practice, we see a lot of that. A lot of times people are kind of fearful of the doctor, have that white coat syndrome, because they don't know, what they're going to tell me this time or whatever. But it's always good, to know those types of things. And unlike 2 Timothy 1:7, God has not given us the spirit of fear, but of power and of love and of sound mind. But the Amplified version, I love that second part where it said, but he has given us a spirit of power and of love and of sound judgment and personal discipline, abilities that result in a calm, well-balanced mind and self-control. And that is what really, if you sum up the cardiovascular, because majority of it is preventable. So that's something we can control.
Yeah. All right. And so the next one, choose you. And so as a woman, we have so many hats that we wear. Off to the right, I think is a good visual, because it's like, she's taking care of her baby, but she's also working. She's doing hair. She's getting groceries. We just do so much. And, we want to be there for our loved ones and all of the different things that, way life pulls us from here to there. We just want to make sure at some point you decide that, okay, I'm going to choose me today. I'm going to, go on a little solo date. I'm going to take myself out to lunch. I'm going to go work out, or maybe I just want to lay across the couch for a couple hours. Like, that is okay. And I think we should really be choosing us more often. I want to say, like, at least once a week, but even if that doesn't work for you, maybe that just doesn't work for you, then do once every other week. Make a decision, make a day out of the week that's for you, where you say no to others and really just do some things for yourself. Get your nails done and all of those things. And then the next slide is just stress relievers. And so all of this stuff plays in your health. If you're super stressed up, your body is just super ramped up, that can cause different problems with your health. And so you want to make sure that you have some stress relievers. I know for myself, I put the gratitude journal to the side because that's something I like to do. But I also like to, like I said, just lay on the couch and watch TV and hang out with family and friends. And whatever you need to do to relieve stress, it's very important to do that. And so think of your stress relievers and do that. And then last but not least, I'm all about action. And so action step, text a friend your heart healthy goal. And so I want you guys to do this so that you can really put into action, what we've taught today. It's all good about getting the information, but it's even better to put it into action. And so, text a friend. And when I say a friend, this is so you have an accountability partner. Maybe it's, I'm going to make a doctor's appointment this week, or I'm going to start doing that 30 minutes a day and walk around, or maybe you're just going to print out the log today. That's something. And so I just want you guys to think of a goal, a heart healthy goal, and write it down, put it on a sticky note and start to do it. Start today, even if you can. And then that's the end of our presentation. I think we're going to get ready and take questions now. Thank you so much for listening.
Before the questions, really quick, I do want to commend you ladies. I do see a couple of our ladies in the chat like, oh, I'm going to work out today. I'm going to the gym right after this. So whatever information you guys have given today, they are definitely taking it to heart. So I definitely want to commend you guys on that. I'm going to go ahead and start off. I jotted down a couple of questions before we got started. So as they're getting their questions together, I'm going to ask personal ones for me. So I know that listening for the past couple of days, I was kind of trying to see where I fit in as a 27-year-old woman. I'm just like, menopause, that doesn't really apply to me. Thank God yet. And the other things that they were talking, I'm just like, I don't know where I fit in there. But then looking at this topic for today, and it says that it affects women 20 years and older, I'm like, okay, well, that's me. So, I wanted to ask you guys, what do you think are some things? I know you guys covered a lot of things that you can do now, but as a younger person, like what are some more definitive ways that you can be taking care of yourself now to make sure that you are less risk for cardiovascular and heart diseases?
I would say being younger for sure, maximizing the physical activity, because a lot of times as we get older, like life happens, I wear all the hats now, I'm a mother, I've been through school, all that, so there's a lot of things I've had to do a lot of days. So my time was short. So if you have that freedom, I would say the physical activity. And not only that, still monitor your diet, because I find a lot of younger people, because like she's like, I'm young, it won't happen to me.
I can eat what I want to eat, this is baby fat that's going to wear off.
Yes, I can eat what I want to eat, but eventually it will possibly catch up with you. So the key is being proactive. So like I said, of course not, turkey every day or whatever. You can do it every now and then, once a week maybe, or once every other week if you can, So that would be my spiel for younger people. Do as much as you can while you are young, because you'll always have that memory in your mind, because your body is your body. You are who you are. And back in the day, I could leg press 500 pounds back in the day in high school. But I'm 41 years old now. I don't know how much I can do that. But I know I had that in me, and I can challenge myself at a later if I decide to get back in the gym. I know I had that in me, and I can challenge myself to work up to that again, because that's already in me. So.
Mm-hmm. Yeah, I would definitely agree. I mean, I was literally going to say that I think the best thing for someone that's like young and you may not have as many back problems or, knee problems and stuff like that, I think definitely maximize like doing more cardio, making sure you're getting some cardio fitness. So I like to do like strength type of workouts, but what I've implemented lately is doing at least once a week cardio. So whether that's like running or doing like a high intensity class, I try to do something that's very like intense and help with my cardio health. Because you can do strength, but ask that person to go run and they may not be able to do it. Right. And so I think it's really important to go out and actually get cardio fitness at least once a week, especially while you're able to do that and you don't have as many like aches and pains. And then to the diet, like she said, it's easy to just be like, I'm good. I'm gonna continue to eat like how I want to eat. But like even for myself, for instance, I really like fried food and like fried okra. And so I ended up running across like a bag that was like lightly breaded fried okra. So just making better choices. And so for me, that's choosing things that's like a little bit better just to get a start. And then from there, you can continue to add on. And I think I know your body will thank you down the road.
Yeah. And I think what you just said was a great point. Like, I think a lot of people hear dieting and they're like, okay, I have to completely X this out. And for most people trying to go cold turkey off of something that you've been doing for 25 years, it's just like, it's not going to happen, or it's going to happen for a couple of weeks and it's not going to be sustainable. And you'll wind up like being upset with yourself that you're not completing doing it and things of that nature. So definitely, I think that we can take into consideration what both of you guys said, but making sure that we make those small adjustments first to kind of get our bodies used to it. And it's like, oh, okay, this isn't that bad. And then you can make a bigger adjustment, a couple months after your body is getting used to it and things of that nature. So that was great.
And write it down. Like I said, make realistic goals and write it down. Look at them daily, because that helps hold yourself accountable. So, write it down, make it plain, look at them, every day. So,
we have another question. How do we determine the difference between an anxiety attack or a panic attack and an actual heart attack?
So that is a tricky one there, because you still have those palpitations a lot with all of them. You can have the heart change with all of them. Um, that I would say, to be honest, just to go to your nearest ER and urgent care for the best diagnosis in that sense. I would not sit home and have this, whether it's anxiety or panic attack, for 30 minutes to me is too long to be in that intense situation. So that was something that you will want to be immediately seen about, to be properly diagnosed. Yes, this was anxiety, or yes, this was a panic attack, or no, you really were having a heart attack. And especially with the heart attack, there's labs that go with it. There's testing that will be definitive that we know, yes, you're actually having a heart attack. So that would be my suggestion for that. So.
Yeah, and I also think it's important to note here that they are very similar. But what happens a lot of times that you'll see patients who have these symptoms and they do like say, oh, maybe I think it was just a panic attack or something like that. And they go to the doctor like months later, and then they still tell their doctor, which is good, and they get that EKG or they get those different readings. And what happens is that the doctor looks and it's different signs, it's different little small things that they can find on the EKG that tells them this person had a heart attack at some point, and the person could be completely unaware that they had a heart attack. They just thought it was, something else. I think something else to note too is if you are a diabetic, that's something else. Those signs can be different as well. There's like data out there that diabetic patients may not know that they had a heart attack because of those like nerves and things like that. And so again, listen to your body. Don't wait to the last minute. It's nothing wrong with giving the doctor a call. There's nothing wrong with going to the emergency department and just getting checked out, going to the American Family Care, whatever the case may be. Go and just get it checked out to be on the safe side.
And even I will also add, even as small as headaches, hypertension is called a silent killer for a reason. And a lot of times I tell a lot of patients this, you think you're just having a headache, and it's not just a regular headache. Yes, we have regular, headaches in general, which is just classified as a headache. But you can have headaches that are more related to you having hypertension. So if you're having more frequent headaches that's not been diagnosed by a neurologist saying you actually have migraines, then that's something that you really need to be in tune with your body and get checked out, because your root of your problem may just as well be you have hypertension. And that is what needs to be treated, which obviously would take away the headache part. So.
Yeah, frequency is a big deal, especially like how often you're having it, how long is the headache lasting? These are questions that your doctor will ask you. And so those are things that, again, you want to take note of. You want to write it down. I actually even went through a period where, thank God it was just headaches, where I was getting headaches and stuff. And I started writing like a journal down. I was just like, okay, at this time, and then it stopped at this time, and then it ended up just being a headache. But it's good to take note of that because, you never know, and it could be something else, and it could be something that can be treated easily, and now you don't have headaches anymore.
I think all of what you guys just said is really important, especially I know as Black women, we're known super women, superwoman, all that, type jazz. And it's just like sometimes we have things going on in our body and we're just like, well, I have too much going on to go and get this checked out. And we have to understand we never have too much going on to get ourselves checked out, because if we want to be here in the long run, we have to make that time to listen to our body, to go to the doctor, to get things checked out. Because even if, like you just said, it ended up being just a headache, that doesn't mean that the next one may be the same thing. And it's something that could be treatable, but it's not treated unless you go see about it. Right. So I definitely think that's really important to put out there. We have another question. What are some products you would recommend younger women to have at home to monitor health for the days that we don't visit the doctors? So I guess the other 364 days when you're not at the doctor's office, what are some things that they can do or use at home?
Yeah, I even have a blood pressure cuff at home. I have one that I just got from Walmart, and I'll check mine every now and then. I never had a problem with my blood pressure, and so it's just something that I check maybe like once a week or so, just when I think about it. And again, making sure you're following those tips we gave you so that you're getting accurate readings and writing those things down. Something else, if you do have diabetes, you probably already have like a glucose monitor where you can check your blood sugar, but that stuff again is available at Walmart. And so that's something else that you can check. Maybe you are concerned with like palpitations or your heart beating really fast or whatever the case may be, there's pulse, there's like monitors that you can stick on your finger and they just sit there and they tell you what's your pulse. And then maybe that's something you can record for your doctor. And so all of these things are very available at Walmart. And so those are three things at least that I would recommend having.
And most people have the smart watches devices, so don't forget those. Those do your heart rate, and some of them also do your oxygen level as well. I know some of the Apple products. I'm sure Samsung probably has the same. So, like I said, they are readily available. So.
Okay. Somebody said, "Let me go to Walmart now." Okay.
There's also one thing too that I wanted to say about, Brianna, you mentioned like being able to, we're always helping others and stuff like that. I want to just quickly use like the plane analogy. They always say, before you help anyone else, put on your mask first, put
Right.
on your breathing mask first. And that's because if you're not doing well, you may be okay right now, but if you continue on that course of just spreading yourself way too thin, not choosing you, not going to the doctor, well, then
That's
you
really
can't
good.
help anyone else. You'll get down the road and now you're sick, now you're tired, and you can't help anyone else. And so, if you want to continue to help your loved ones and be around and be there for your loved ones, then it's important that you take care of yourself first.
Yeah, that was great. Okay, it's about 12:37. I know in a second Miss Matthews is going to be saying we need to wrap this up. We have maybe like two more questions that I'm going to ask really, really quickly. Does heart health affect hair loss or growth?
Well, certain medications that you're put on can cause alopecia. So I'll say it's certain medications that possibly can cause that. Not necessarily, I would say you having the heart health. That would be more of a endocrine issue rather than a heart issue. But there are certain medications that can affect the hair growth. So.
Yeah. And yeah, there's different medications. We all know that all medications have side effects. Blood pressure being one of them. Blood pressure meds can cause some thinning. And so if you're concerned about that type of thing, again, make sure you tell your doctor because they can assure you that, oh, it's just the medication. Maybe this is something you can add to your regimen in order to help with that hair growth. So that's something for sure to ask your doctor.
Okay. As women, how can self care become more a part of your daily or weekly life? And how much should it be a part of your life? I know we talked about listening to your body, choosing you, taking that time. So, how should you figure out how to fit that into your schedule?
This is, oh, yeah, you want to go? Okay. This,
Make it a priority.
yeah.
So make it a priority. Like, so for me, I literally I've been getting my massages for years. I make that a priority. That's something I get every month. It's like, it's my normal monthly clockwork. I don't work that day. That is my personal self-care day. Usually that day I'm getting my nails done as well, but I make it a priority because I do so much. I have to do so much. So you have to, you have to prioritize you if you plan on being here a long time. You
Right.
have to take care of you because the world is going to continue to turn. People are still going to continue to people. They're going to be there. Whether you're there or not. So it's your responsibility to take care of you. So you have to put it. I literally put it in my calendar. I make my massages out actually for the whole year to be matter of fact. So I make it a priority. So
Yeah. And that's basically what I was going to say. It's easier said than done. However, like for myself, like when I started my second year of medical school, my first year, I had stopped working out. I just wasn't doing all the things for myself. I was just trying to get it in and do well and all of that good stuff. But then second year I came in, I was just like, enough is enough. I want to work out. I want to get back to doing that. I want to do my meal prep on Sundays, get my food ready for the week. I want to do it. And so now I just, no matter what's going on at 5 o'clock, I'm working out. And no matter what's going on Sundays at 4, I'm making my dinner for the week. So you just have to you have to tell yourself, I'm stopping. Enough is enough. And you just have to do it. You just have to do it because there's always going to be reasons. There's always going to be reasons to not do it. And so you just have to do it. And then I also saw something about like adverse effects as far as medication. I do want to note that every medication has side effects, but do not let that stop you from taking your medication. I think that every side effect is not going to affect everyone. And it's always that small percentage that it may affect you. And in that case, don't just take yourself off the medication. Go to your doctor, go to your healthcare provider, and be like, hey, I'm having this problem, because they can switch you, or they can, lower the dose. They can do different things to help you. And a lot of times it's really an easy fix, as simple as changing the med to something super similar, or as simple as, like I said, lowering the dose. And so don't just, I think a lot of times patients will be like, I'm just going to stop taking this. I see my doctor in 3 months. But don't stop taking it. Call your doctor. Let them know, like, hey, this is going on, so that they can get you in quicker.
Yes, totally agree. Keep an open communication line with your provider. Be honest with them and let them know. Because if you don't let them know, we don't know. We just don't know. You know your body. As you present that information to us, that's how we know how best to treat you. So do not withhold that information. And like you said, do not stop taking your medication. Your numbers are great because you're on that medication. Do not stop taking the medication. So.
Well, I think that was the last question for today. I know if we keep going, we will get some more. So we're going to go ahead and wrap it up. But please feel free to reach out to these people, Miss Victoria Brasher, Miss Dakota Wyatt, anytime. And if you guys have any questions, I'm sure that they would not mind talking to you guys for however long you need to. But I think we can wrap this up and just definitely say we will do a better job as women about committing to ourselves, committing to our health, committing to our mental health, all of those things like that. So I think we're going to go ahead and wrap up the question and answer segment, and we're going to get into our giveaways. So let me see which numbers we're going to get today. I got the number 181. 181. And I think our team is going to help us out with who that is. The next number is one. Oh, they said pick another number. Maybe they won already. Okay, let's do 152. 152. Sharon McWayne. I think that's about right. We're going to type it in the chat. So Sharon, congratulations to you. The next number is 103. 103 is Meldrin Jones. Meldrin Jones. The next number is 29. They said that was a previous winner as well. Lord, these people is getting it in. Okay. Let's try it. 3. The next number is 3. Tawana Jones. Tawana Jones. Congratulations, Tawana Jones. Okay, we have 2 more numbers to do. I got the number 65. 65, maybe? Peggy Spence, and she's been in the chat this whole day. So congratulations, Peggy Spence. And then our last number, let me make sure this isn't a number I put in already. Okay. The last number is 119. Sabrina Chisholm. And that is our last winner for today. So we're going to clap it up. We hope that you guys come back and join us tomorrow at 12 o'clock noon for another dynamic Word of the Day segment for the ladies. This has been so much fun. Thank you again, Miss Brasher and Miss Wyatt. And we hope that you guys will be tuned in with us as well on tomorrow. So we'll see you guys again tomorrow.
Thank you.
Thank you,
Have a great rest of your
everyone.
day.